Hey everyone, welcome to Microsoft Teams for Healthcare. We just wanted to let you know that we will be getting started in a couple of minutes here, so feel free to hang out or grab a beverage or take a quick bathroom break before we dive in, and we'll be with you in just a moment.
Hey everybody, thanks for joining us today for our Microsoft Teams for Healthcare webinar. This will be one part kind of presentation and another part some demonstration and show and tell through a demo tenant that we have spun up. So thanks for giving us your time today. I'm Eric Clark. I've been with SWICKtech for a little over 3 years. I'm a client success associate here, and co-presenting with me today is Shane Craning.
Hey Eric, glad to be here with you.
Yeah, thank you so much. I just decided to put you live for a second there. How about that?
Oh, I see what you did there.
You could introduce yourself.
Yeah, I'm super excited to be here with you. Also a client success associate at SWICKtech, and just really looking forward to diving into what Teams can offer for healthcare organizations today.
Fantastic. So I'm going to cover just a couple things here. Bear with me for just 1 second so I can get that back up. There we go. Okay, so just a little bit about SWICKtech before we get started for those that are not familiar. SWICKtech has been around for about 17 years. We have just about 30 employees, and we have a single location out of New Berlin, Wisconsin. We are primarily a managed service provider, but we believe in putting security first. And we have all sorts of different teams on our team. We have a SOC team, which stands for Security and Operations Center. We have a DevOps team. We have folks that understand a lot of specialized areas of IT, networking, server, cloud and Azure Gov and those types of things. So we're ready to really tackle all sorts of different areas, but today specifically, we're going to talk a lot about Teams and Teams for Healthcare. We spent a lot of time in Teams, and so we just want to share some knowledge about it. And we try to start with why are we doing this presentation today? If we look at the last year, everything that we've gone through, patients turned to virtual care in droves this year or this last year amid the pandemic. I think it's a long-term shakeup of the healthcare delivery system, and it's expected as a result of the pandemic, with digital pathways to care accounting for a larger share of medical visits and spend. I think that the market and the industry is kind of going towards telehealth regardless. This just kind of sped things up. So it's not just about patients looking to check urgent care needs in the comfort of their home. Hospitals are getting into the action too, so they're investing in capabilities like digital post-surgical follow-ups, tele-ICU, tele-stroke, and about 76% of hospitals used telehealth in some way before the pandemic, like I just mentioned. That number is likely snowballed, obviously, in 2020. So Teams is a centralized digital workspace that contains all of your chats, meetings, calls, files, tools, and it's all in one location. So you can bring together your full care team with a line of business apps and electronic records, enabling clinicians to collaborate in real time around their specific patient needs. All within the hub that reduces switching between apps, tools, and the best part is it's HIPAA compliant. So it really does meet the needs of healthcare in a major way. And again, we at SWICKtech love this platform for a number of reasons. So with that, I think, Shane, you are set to present on a whole slew of things that are Teams for Healthcare related.
Great. Thank you, Eric. I appreciate the little intro there. And yeah, the why is super important, right? So thank you for touching on that a little bit. I do want to call out a few things as we dive in here today before we kind of jump into the meat of this presentation and talk about the actual applications of using Teams for Healthcare. There's just a couple of important things you should know. Eric kind of touched on a little bit that Teams can be HIPAA compliant. I do want to point out the emphasis there on can be HIPAA compliant. So just purchasing Microsoft 365 licenses and letting your staff run wild is not the solution, right? We do want to make sure that the environment is appropriately designed and set up to meet those security needs and those compliancy needs. And then just a quick little, housekeeping item here. This is a virtual event. I am going to be jumping back and forth between a presentation and some demonstration today to show you how you can use some of these in Teams. And so just keep that in mind as we go here. Feel free to post questions in the Q&A. If you'd like specific questions answered, we'll try and take those as they come in as appropriate. But if not, we can always get to questions at the end too if there are leftover questions. So with that, we are going to talk about the healthcare collection in Microsoft 365 today. So Microsoft has done a really good job of building out different ways to use a lot of the tools and features that they already bring to the general public and to organizations and government into the healthcare sector, and kind of tweaking them and designing them to be used really purposefully in the healthcare environment. So today, what we're going to touch on are a lot of areas that are just in Teams, but with a bit of a healthcare or hospital or clinic spin on them and how you can use them in your appropriate environments. And so with that comes, a lot of the regular Teams items that some of you may be familiar with: chat, calls, shifts, calendar, and many more. So bookings and approvals and lists are some that we'll dive into today and show you. I do want to point out this is just scratching the surface, right? So if you're at a healthcare organization and you're really interested in using Teams, this is going to show you a little bit about what you can start to do with it. We're not going to get into the nitty-gritty of configuring a lot of this stuff. I will show you very briefly a little bit of administrative aspects on the back end here, but really this is more to just show you what Teams can do for you and how it can work in a healthcare setting. So with that, I'm just going to dive into these items. Like I said, I'll be switching back and forth here a little bit between the presentation and actual demonstration to show you how some of these work. But first up is Shifts. So the Shifts app, like I said before, is built in to Microsoft Teams. It's a tool that can be used in any environment, but it's especially useful in healthcare when you can build out shifts for different teams and departments within the organization, right? So you can see here in this example, There's clinical staff, surgery, nuclear, so forth and so on, at ICU, NICU, and etc. And what this allows you to do is build out different shifts for different staff, whether that be managers, nurses, doctors, surgeons, and so on, and allows you to manage and organize that all in one place. And then also allows people to check in and out of their shifts, as well as book shifts and pick up new shifts. And so, like I said, we'll switch here back to, or over to our Teams environment. So this Teams demonstration today is designed, like I said, to be healthcare oriented. So you'll see a lot of this related to healthcare topics and doctor's office, clinics, and the like. So if we go into this Shifts app on the left-hand side here, we'll let this load for a sec. You can see we've got all of our staff's shifts, and you can scroll down and see, the different managers. And then up in the right-hand corner is where you can set it up so that people can clock in and clock out of their shifts, start breaks. You can export your timesheet if that's how you want to handle your time clocks. And you can also go in here and add shifts for people to pick up. So if you're a manager, you can add open shifts and say, there's an overnight shift from 7 p.m. to 7 a.m. that I need someone to pick up each day. And then someone can go in here and grab that shift. As an individual, you can also swap shifts and trade shifts with others. So if there's a shift that you can't make, you can go in and change that. So that's a real brief overview on shifts. It can be a very powerful tool for allowing your employees to kind of manage and control their schedules, as well as allowing management to control and organize that as well. So the next piece of the Microsoft staff that I want to touch on is very similar, but very different at the same time, and that's Microsoft Bookings. So Bookings is a really quick and fast alternative to scheduling appointments and tasks for organizations, right? So in healthcare organizations, obviously you have a lot of appointments scheduled with patients, whether that be surgeries or walk-in visits or urgent care visits, anything and everything in between. It allows you a couple of ways to handle that. So a lot of people may be familiar with Calendly. That's like a scheduling app that you can share with other people. You can do that same thing with Microsoft Bookings, where you have a set schedule for you or your staff when they're available, and you can publish that and allow people to sign up for appointments or book appointments when available. Now, in the healthcare sector, that's not super common, right? So Bookings also allows you to use it internally facing. So you can set up Bookings but not publish it to the public, and allow an environment for your administrative staff or your receptionist or office staff to have a calendar of everyone's schedule. So this will coincide with their actual work schedule on their Outlook or Office 365 calendar. And then you can go in and book appointments, and you can design and create the different types of appointments so that they're built around your needs. So this is going to facilitate, the traditional walk-in or in-person visits, but also you can design this for virtual visits where you can then set up an appointment and it will automatically send that person a Microsoft Teams event for them to join the event and meet with their doctor or nurse. So shifting gears back over to our demo environment, very similar to Shifts, you're going to have a Bookings tab that's built in to your Microsoft 365 environment and your Microsoft Teams, and you can have different staff and you can schedule, oops, sorry about that. You can schedule when they're available. Obviously, this environment has not been set up with different appointments and stuff just yet, but you can see you can add different staff, right? And an RN, maybe a biomedical equipment supervisor, and so on at the clinic. And then you can also change and control the different types of calendars that you have, right? So this environment has just the one clinic, but if you had multiple clinics or maybe different types of departments within your clinic, you could have different calendars for each of those and different staff or doctors or nurse listed for each event. And then you can just go ahead and add staff or create new bookings. And this environment, when we're talking about facing the public or even just internally for your office staff, as I mentioned, is very customizable. So you can go in, you can add a logo, you can add all kinds of different calendars and departments, and you can assign the different staff to different departments or multiple departments as you see fit, so that when you're in here scheduling, you can easily access the calendars that you need to see and book appointments. When you do a new booking, you can also generate what type of booking it is. So you'll see here, this is built out so that you can enter in the person's name, their email address, and a phone number. And then you can mark off different flags, right? So we have a flag here for attendees have consented to email communication if that's appropriate. Oops, I apologize. We're getting an error message in our demo. So when you go into, it does not want to show me that right now. Okay, there we go. So when you go in and you add this and you set up a calendar invite with a staff member, you can choose whether or not this is going to be a Teams meeting and what type of meeting it's going to be. So you'll see up at the top here, we have a virtual visit versus an in-office consultation. So as I mentioned before, with the virtual visit option, it's going to automatically make this a Teams meeting. And that's a setting that you can set up in the background, and that's going to add a link for that virtual visit. So virtual visits, right? Super important these days, like Eric said, with the pandemic and everything going on, and really just there's a huge value add for being able to allow people to visit virtually with their doctor or nurse and not have to come into the doctor's office for every little detail. So Microsoft,
it's a huge time saver too.
Absolutely, yeah. Everyone loves that ability, right? Every now and then, obviously, we're getting probably a little sick of it these days, but in general, right, the idea that you can just call up your doctor on a Teams call is really appealing to most people. So Microsoft realizes this, and they have started to build in an EHR connection where you'll be able to communicate with your Microsoft Teams environment or Microsoft 365 environment and your EHR. The biggest and most common solution out there, Epic, is the first EHR system that Microsoft has partnered with to do this. I believe that they're working through others as well, so there will be more options out there. But right now, for sure, you can connect with Epic and maybe a few other EHR systems if you have a different one. And what this allows you to do is tie that patient environment or that patient portal where, you know, myself or Eric or any patient would sign in and access their chart information and all of the details about their doctor's visits and everything. And then they would be able to get immediate access to those virtual visits. So this way, on the back end, your office staff or administrative staff can go ahead and book or schedule that call on the booking side, and instantly it will generate a Microsoft Teams meeting. It will send the doctor or the nurse or whoever is going to be on the call an email and a calendar invite. It will also send the patient that email, and it will also generate an appointment in the EHR system. So now when that appointment comes time to join, the person can just sign into their patient portal and click on that virtual visit button, and in they go, and they're in the call with the doctor or nurse. It is like designed to be very easy to use from a guest or patient perspective as well. So that's important to call out. You know, I said the doctor or nurse will get a calendar invite right on their calendar. It will show them all the details, and they'll join, and it will sign them in with their Microsoft license and their Microsoft account and name. The patient won't have to go through all that. So they'll get a very simple, easy to use join link where they click it. They don't need to download or install Teams. It's very similar to Zoom or any other live platform where they can just go ahead and say that they're a guest and, you know, type in their first name or whatever and jump into the meeting. So moving right along, a next item that's really useful for healthcare organizations in Microsoft Teams is lists. So lists allow you the ability to generate a list of really anything. A lot of common examples are maybe a list of clients or patients. Maybe you have a training checklist from your HR team that a new employee starts. Maybe you're tracking issues or requests for your IT staff, or, you know, what have you, asset management, events, the list goes on and on. But lists are just built out where you can go in and you can add any types of information that you want. You can categorize it by name, color, You can add specific serial number fields if it's an asset tracking list, and so on. So it's a really useful tool for tracking all kinds of different data. You can see this example here is referring to the patients that are visiting today, right? So they've gone in and they've exported the list of patients, and it shows you each patient's name, their insurance, their registered number, their diagnosis, date of birth, so on and so forth. And these are very customizable. So just to give you an idea of that, if we jump back into Teams, we have generated an equipment list for this clinic. And so what you can do with lists, they're actually technically hosted in SharePoint and you can view them from SharePoint. The most functional and easy way to get access to them is from Microsoft Teams. And so you can add a list into any Teams channel, and you'll see here we've built one out here already. So you can see this is kind of an asset or equipment related list. So you can go in and see, okay, here's the name of the asset, here's its availability, the manufacturer that created it, the condition that it's in, the price that it costs, the color of the item, if you want to call that out, what type of item it is. And you can adjust this, you can add additional columns and fields, and you can store, even though it's not all displayed here on the main page, you can store more details about each individual item on this list.
So Shane, is there a workflow for lists, like from the EHR platform, or if someone is using bookings to book an appointment, can you set up a flow where they populate in a list like this? Where is it coming from?
You could, yes. So generally speaking, lists can come from anywhere and everywhere. You can create them manually to start, right, from scratch, and then edit them as you go, right? That probably makes sense for something like this where we're tracking assets in a list, right? You import or insert all of the new items as you get them, and then it just keeps up to date as you change things. For your example where we're talking about patients, yes, you could implement, for an example, a Power App or a Power Automate flow that should be able to take those booking events and import them into a list. So now to that point, you could get like a patient list that's showing you all of the patients for the day. That's obviously going to be a lot more complex than what we're going to cover today, right? Because you're going to have to dive into some coding and building of some apps. There's some additional licensing involved in that and all of that, but it's certainly possible. So this is a real simple basic list that we've generated here, but you can dig in and have more information. You could show it on the display here and filter what you see. You can also click into these items and you'll see you can fill out more specific fields, right? Like an order number, a due date if you have like checkout requirements for when people need to check back in items, a model number, serial number, and the list goes on. You can add and edit to these and change them and rename them. And then when you create a new item, you can import all of that information. You can add images, etc. So lists can be a really powerful tool for tracking equipment, keeping tabs on patient visits, and anything in between. So the next item that we want to touch on a little bit today are approvals. Approvals, again, is another category that's just baked right into Microsoft Teams. Anybody and everybody can use it, but it can also be very, very useful for a healthcare organization. So you can streamline a lot of your requests and processes within your team by setting up approvals, right? So now rather than having to send emails back and forth to communicate something with a manager, a colleague, or a doctor, you can use these approvals to make it a one-step process where you submit a approval, or I guess two-step process. You submit the approval or request, and then the doctor or nurse or whoever approves it. So a couple of good examples of these are maybe different proposals or agreements that you have for your patients that you want to get approved. Maybe you send out monthly newsletters to all of your clients or patients, and you want those approved by 1 or 2 or 3 staff before they get sent out to everybody. A common just general business use for approvals are expense reports or expenses or PTOs, submitting for time off, that sort of stuff. And you can, just like everything else that we're showcasing today, you can access this right from within Teams. So if you don't see it and you click this little ellipses, you'll get an approvals tab here. I don't believe I have anything specific set up in here, but you can actually just go right in and create a new approval request. So if you just want to start using this today, you can jump in approvals, create a request, and send it off to the person that needs to approve it. If you want to actually build this out, we have actually shown in another previous webinar about Power Apps and Power Automate how to build flows so that you can automate a lot of these approval processes. So then you could take a document or information, or even one of those lists we just talked about, right? When you generate a new list item, create a request for an approval, and you can start to build out a lot of automated processes in your environment for managing approvals. So I know I mentioned I'm not going to dive too deep into the administrative side of Teams for Healthcare, but I do want to call out that Microsoft has done a very good job of building out an administrative solution in your Teams admin center. So if you're the type of person, maybe you're on the IT staff, or you're in a seat where you have to control and set up this environment for your team to be able to use Microsoft Teams, there are a couple of important things to note. They have what are called policy packages, where you can go in and assign individual policy packages to the different types of employees. So the examples that they have listed here for healthcare environments are a clinical worker, an information worker, and a patient room if you're using resources like rooms and calendars. So this makes it really easy for your IT team or whoever manages your team's environment to go into the admin center and build out these policies for the different types of staff and employees that you have so that they see the appropriate information, right? So this is going to tie who those individuals are. If you're a clinic employee, obviously you want to see patient information and all the details that are going on in the clinic. If you're an information worker and you're more on the administrative side, maybe you don't need access to all of that, right? So that's where a lot of that compliancy and security comes into play, where you can control who has access to what and who can do what within your Microsoft 365 environment. And then one other item that I did want to touch on the admin center side are Teams templates. So Microsoft has done a good job of building out templated solution for Teams, and you can actually build out hospital or clinic related teams so that they come with all of the different channels baked right into them from the get-go. So it's really easy to get started. And if we jump back into our demo real quick, I will just show you that. So if we're in our admin center, you can go right into your Teams portal, and it's going to prompt me to sign in. So give me one moment while I hunt that down.
Should have queued up some Jeopardy music for this part.
Oh, it didn't take me that long, did it?
No, good job.
All right, so getting signed back into our Teams admin center here, you'll see these are really easy items to find. I won't dig into this admin center too much because I know a lot of people won't be doing this, but just to show you that these do exist in here. In any Teams environment, you'll have templates, and you can see there's ones for patient care or hospital that are going to build out very specific channels for your use. And now you can certainly change these and tweak these, but the really nice thing is you'll see they've kind of taken some consideration into not only what are these channels going to be, what should they be named, but also what should they have. So this huddles tab is going to automatically add that patient list that we talked about earlier. So you can just go ahead and create this team, and then you're off to the races in building out a solution for your staff to use. And then the policy packages aspect, just to point out that those exist in here. You can see those healthcare worker roles. And if you click into these, they're going to give you more specifics about each specific policy. So what's the messaging policy, the meeting policy, and the app policy. And you can go in and edit these and change who can see and do and edit the appropriate aspects of your team's environment. So Microsoft Teams, right, enables physicians, clinicians, nurses, and other staff to collaborate efficiently. And that's just kind of what we want to show here is you can use all of these different pieces of the healthcare environment to make a cohesive solution for your staff to be able to interact with patients, have internal chats and those virtual visits or meetings with your patients. You can store and share your files and lists and documents and all the other information. You can share those lists and track that information. You can track and monitor the different tasks or assets that you have in your environment. And it really makes it super easy to kind of streamline those approvals and those lists for you and share schedules and book clients appropriately. So before we dive into Q&A, we'll give you an opportunity to ask a few questions here. But Eric, if you want to just touch briefly on our next webinar coming up in a few weeks.
Yeah, absolutely. Happy to do so. You know, there's an announcement on November 30th of 2020 that the Department of Defense and government had put out that security or cybersecurity has become such a huge risk that the threat surface is so large and hard to mitigate that they're creating what's called the CMMC model, which is very similar to what was called the CMMI model, which stands for Capability, Maturity, Integration. So what we're doing is we've helped a number of organizations and companies help meet some of these compliances that are related to NIST 800-171. And as this new kind of model gets rolled out, there's going to be some time before any auditors are going to actually be able to audit if someone is or is not compliant. So we're helping organizations go through some of those processes so when it comes time to be audited, you can be compliant, at least on the IT side of things. So we're hosting a webinar on Wednesday, April 21st. That's going to cover some of the basics of that. Why is this important? Why is this happening? What are the various levels and what lives inside of those levels? And what can you do as a business to prepare for that? And so that will be a webinar that we're hosting that I don't think anyone in this audience would have a big need for, but we want to just showcase that that is one that's on the horizon here.
Thank you, Eric. Yeah, and I do want to point out this series of webinars, right, where we're talking about specifically CMMC and governmental contracts. It's obviously a requirement for people in the government pipeline, but it is super important that your environment is secure, especially when we're talking about healthcare solutions. And so this series isn't just for folks who need to be CMMC compliant, but it's also going to show you a lot of tools and ways that you can level up your cybersecurity in your own organization and make sure that you're protecting your company as well as your clients or patients. So it's super valuable for really anybody. And with that, we will open it up for questions. I know this was a bit of a quick webinar, so if people have questions, feel free to post them in the Q&A and we'll answer them appropriately. Thanks for joining us today.
Thank you, everybody. Okay, looks like there's no questions, so we'll go ahead and end our session. Thanks everybody for hanging out with us today and watching.
Thanks so much.